see first of all, what is pancreatitis? As the word speaks for itself, pancreatitis means inflammation of the pancreas. But the special characteristic of the disease is it is a progressive disease. Once there's a pancreatitis, it never goes back, it keeps on progressing. And that's why there's a significant mortality is associated with the disease. And the first case of pancreatitis came in the world in 1682, where a Brazilian in Brazil, where a Dutch anatomist identified it. And in India, the first case was identified in 1937. But you can see that by 2015, the world has seen the upsurge of annual pancreatitis patient with the tone of 8.9 million cases globally in that year. And besides, the number of cases are increasing, but the mortality is increasing. There is a study published which says that 55% people survive for 20 years in a country like the United States. And the disease, while it has so many things, it affects physical state, mental state, financial state, social state. So it is a big burden to the people. Now the question comes, what is very special about this pancreatitis? The pancreatitis inflamed of the pancreas stop the flow of enzymes from the pancreas, which is essential for the digestion. And when these enzymes are within the pancreas, it develops autophagy, means self-destruction of tissues. So patient may start losing weight, and patient may start feeling poor digestion. So these are the miseries related to that. And broadly, pancreatitis can be classified into two forms, acute and chronic. Acute means a patient may have history of disease for 5 years with many attacks, but it can remain acute because there is only inflammation. But a patient can be a chronic patient without any attack because it is distinguished by the structural changes which can be seen in the images like ultrasound, MRI, CT scan. So this is very important to know because many people feel that acute means sudden and chronic means old. But in this category of disease, acute and chronic can be from the day one and acute can be for 5 years or maybe more. So the diagnosis of the pancreatitis is very crucial. It is not an easy diagnosis. So diagnosis should be made by a competent gastroenterologist who is not only well versed with the diagnosis of pancreatitis, but he or she is well versed with the other disorder of GIT. And it is not a clinical diagnosis. It is based on images. It is based on ultrasound, CT scan, MRI. The ERCP is an invasive test and MRCP is a non-invasive test. And the worldwide, MRCP is considered to be the most safe and easy way to understand the diagnosis and to note the progression and regression in any case. Worldwide, alcoholics are blamed for having pancreas. Alcohol is considered as the main causative factor for the pancreatitis. But you can read no definite cause. And in my forthcoming slides, I will show you how this is how it is different than the alcohol cause. But the worldwide, the one factor has been accepted, which is called T-GARO. T for toxins, that includes alcohol also. And an interesting finding is, though alcohol is blamed for pancreatitis, but only 3% alcoholic get it. And second is idiopathic. Nobody knows why it is coming. That is called idiopathic. G for genetic. There is a saying that 15% patients come from the close family. And A for autoimmune. Again, it is an idiopathic type where nobody knows why it is this. And recurring acute pancreatitis may lead to chronic pancreatitis, that is called R, and O for obstructive jaundice. Many patients who have gallstone, they develop it. So these are known as T-GARO factors, but none of the factor can be said that it is a short diagnosis of pancreatitis. In India, the studies published have indicated that in Indian scenario, pancreatitis is more prevalent among non-alcoholic, and they found it is a protein malnutrition and mineral deficiency, and that's why it has a different name called tropical chronic pancreatitis. Symptom of pancreatitis is very peculiar and it is confusing. There's a sudden onset of pain in the upper abdomen, and this pain is different than other pain of the abdomen because which should be there minimum for 2 days, not responding to any conventional or routine treatment. So that is the upper abdominal pain, severe category. At VAS score, it can be 10, and it radiates to back with nausea and vomiting. But this is in 90% cases. But in 10% cases, there cannot be any symptom other than weight loss or passing fat in the stool or uncontrolled blood sugar. So these are the, in general, symptoms of the thing. And the treatment for the disease is, if there is a treatment but no treatment, because treatment is basically management of emergency attack by hospitalization. And for 3 to 5 days, there is no fluid, no even water from the mouth. They are giving intravenous fluid, antibiotics, painkillers, anti-inflammatory. And afterwards, if it is a chronic pancreatitis, there will be a regime of lifelong pancreatic enzymes with moderate eating, no dairy, no milk, no butter, no fat, no egg, no meat like that. So this is the worldwide treatment. And in India, there is a law that an Ayurvedic physician can prepare his own medicines for his personal use in the clinical practice. So this is the peculiar law in the country, which is nowhere in the world, because Ayurveda was there in the tradition. So my father, who had a Guru Maharaj, he used to make his own medicine and following a very special branch of Ayurveda that is called Ras Shastra. And Ras Shastra means science of mercury and metals. And these are toxic in raw form, but he was taking years and years to make it. So in 70s, he started a formulation taking copper, mercury, and sulphur. And after 2-3 years, when this medicine was in a final stage, it was given. I think he was forced to give to a dying patient because the family was very keen to take this treatment from him for advanced pancreatic disease. And then my father gave it. So this was the incidental finding that this particular product gave a miraculous recovery to a dying patient of advanced pancreatic disease. So this was the journey. It was not a well thought, it is not a well researched, it just happened. And after that, my father was making medicine and giving to the patient with batch to batch variation. He passed away in 1984, and then I continued his practice. And between 1984 to 1996, I saw the same recovery rate in pancreatic diseases. And then I started documenting of my practice, following good clinical practice from 1997 onwards. And the first case who came to me in 1997, this is a coincidence that he is present in our hospital with his father, who had been diagnosed with a pre-leukemic stage. So he completed 23 years. But till then, and these are cases who came to us, no one was diagnosed by us. They were diagnosed by the leading gastroenterologists in a reputed hospital by following the guidelines of the modern medicine for the diagnosis of pancreatitis, different type of pancreatitis. So we are going to present today the data of 990 cases who have been enrolled in our clinical practice from January 97 till June 2020. But the majority of the cases are from November 2014 to 2020, because for 14 years, 97 to 2014, we have 48 cases only because it was word of mouth. But in 2014, we got a shot in our arm when our state government did a big seminar and when we presented everything. So since then, we have good flow of the patients. So nearly 900 cases, 950 cases have been enrolled in last 5 years. So you can see that when these patients are from the different age group, and we are finding of late, very interesting thing that below 11, the youngest case is 3 years old, been diagnosed with pancreatitis. So we have 38 cases who are below 11 years, but the majority of the cases are 19 to 45, which is the productive age group, and its average onset in the world is 24 years. But by the time the age increases, the number of cases decreases. That is the generation of data which we are showing from our clinical practice. So AMAR is a compound which was developed by my father in mid-70s, and now we have reached to a stage where it is well researched and standardized form, and it is named AMAR. When we started treating our patient, because a lot of dilemma is about metals and minerals, so we have very interesting category of 24 cases who came to our practice. They took the medicine but never started. These are 24 cases. We have 17 deaths. As I said, that the disease has significant death rate, which is about 55% patient die in 20 years in United States. But our data of 990 cases of India shows a very interesting thing, that nearly 92% patients survive 10 years. Because after 10 years, the patient enrollment is very poor, nearly 7.3%. So from that death rate, we have come down to 17. And in this deaths, we have included even those cases who could take treatment only for 5 days, or when they came to us, their bilirubin was very high, they were full of edema. But whatever it is 17 death rate. We have 7 patients who showed relapse and progression of the disease even after completing 1 year treatment. But nearly 50% patients have completed 1 year treatment, are living disease-free and fear-free of the disease. Nearly 30% patients are on treatment. 5 patients have lost to follow-up, and there are 133 cases who did not continue treatment due to obvious many reasons. So this is our data, and what we are saying, the patient who completed 1 year treatment, these 465 cases, that is very amazing, very astonishing. We have 98% patient out of those who have completed are living disease-free without relapse, which I will show in the next slides. This is the impact of Ayurvedic treatment, which brought us last year in Hawaii, where there was 50th joint annual meet of American Pancreatic Association and Japan Pancreatic Society. It was a group of leading HPE, hepatic, biliary, and pancreatic disorders specialists, and we were the only non-conventional doctor who were invited to that. And out of 620 abstracts submitted, they selected 50. There was 1 year treatment. So these patients who came to us, these were 476 cases, who had weight loss, weight gain, number of attack, and hospitalization. That was before Ayurvedic treatment in the previous year. But when we started Ayurvedic treatment, you can see the number of hospitalization, which was 1,097 in the previous year, has come down to 36 years after Ayurvedic treatment. One can say only, wow, how this has happened. And the emergency attack from 1763 has come down to 104. Nearly 90% patients did not experience any attack. And similarly, the weight loss, because one of the clinical features is weight loss, it has stopped. Now weight loss is less and weight gain is more. So this is something very rich, and what we received the comment, enriched with content and volume. So this data made us very proud, very happy about the efficacy of this mineral formulation in the treatment of pancreatitis. This slide showed progression stage, and 262 patients have been evaluated pre and post, and we could not see any progression in any case. So that again reinforces our belief in the medicine, that this medicine, this mineral is the cause of the disease, and this mineral is the answer of the disease, as there is no progression on these cases. And this practice has been continued now. Now all the patients are being evaluated for progression after 1 year, 2 years, 3 years, and so. Any disease in Ayurveda, I'm fascinated by the theories of Ayurvedic concepts and practice. And one of the definition of the medicine says a medicine should be able to cure the disease. The medicine should not cause any adverse effect or cause any other disease. It should be easy to consume. And number 4, the relapse should not be there. The relapse. So many times we see the modern medicines are able to treat the patient in acute condition, but after some time disease come back. But with this slide, we are trying to show you the sustainable effect of Ayurvedic treatment. And here you can see the 6 patients are those who have completed more than 20 years. As I said, the first patient has completed 23 years. There's the category of 15 to 20 years. So we keep an eye on our patient. And out of 476 cases, as I said, that there are 5 relapses and dropout and 6 deaths, including accident or heart attack, whatever it is. So this shows 98% patient have a sustainable effect of this treatment, which is unheard, unseen, and this is a wonderful data which is I'm showing to people, because for many people it will be unbelievable that a patient of pancreatitis is living disease-free, attack-free, and leading a normal life. AMAR is prepared using copper, mercury, and sulphur. But from where it came? So it is a specialized branch of Ayurveda called Rasa Shastra. Rasa is a synonym of mercury. So this particular branch of Ayurveda was developed during 1st and 5th centuries in a place called Takshila and Nalanda. Takshila is in Pakistan now, and Nalanda is Bihar. And Acharya Nagarjuna was the first person who has developed it. And you may recall that 1st to 5th century, 1st to 11th century was a golden period of India, where India was very culturally strong in their tradition, their knowledge, their wisdom, the prosperity. So this science was evolved during those periods of the time. But all the raw material of this Rasa Shastra, either of plant origin or animal origin or mineral origin, are moderate to severely toxic in raw form. And then there's a special methodology which takes 2 years to 5 years or 10 years to convert this non-toxic into therapeutic form, life savior. So this is a particular thing. And when we come out about the many diseases which we cure in our practice, we don't find any direct reference. Like pancreatitis is not mentioned in Ayurvedic text, but it talks about Shodhan, inflammatory disorder. So copper is an anti-inflammatory. Copper is a poison in a raw form. And when we convert this copper into medicinal form by following the methodology laid down in Rasa Shastra of Ayurveda, they becomes like magic drug and they become life savior. So it is not necessary that you will get the reference exactly, but as an anti-inflammatory, so many anti-inflammatory disorders are being treated successfully by using AMAR. Now I show you how we make this medicine, because the first thing I say Parad. Parad means mercury. So mercury is taken, then Tamra is copper, then Gandak is sulphur, and on the right side and the bottom, there are 3 herbs. One you can identify as lemon, and there is a Devdali called Lapha echinacea, and Aprajita is Clitoria ternacea. So these are our basic raw material. Next, please. And these, now the process starts. Mercury, which we take, you can see this, it is a shriveling shaped apparatus which we design ourselves. Mercury is amalgamated with copper, and after that it is put into the clay pot. Fire goes from down, and it is covered from the clay pot, and water is coming down to cool down. So we evaporate mercury from copper, and again after evaporation we grind with copper, again evaporate. So this is called 7 times extraction of mercury from copper, and we call it Tamrut Parad, that mercury has been evaporated from copper. So copper is an inorganic poison, mercury is an inorganic poison, and both poisons are being processed together. What happens to mercury, we don't know, because mercury remains like mercury, but after this thing, the mercury goes into organic poison. These are 7 plants which are quite toxic in raw form. This plant, I don't remember the English name right now. Calotropis, something like it's milk. If you put in the eyes, it will damage your eyes. Similarly, this red color plant, if somebody eats, it will choke the throat and it may kill also. So these are all 7 organic poison which are ground with mercury for 40 days, and after grinding with each one, it is again evaporated. So this process, this doesn't change the physical state of mercury, but this mercury become active. And one study carried by atomic spectrophotometry shows that this sort of mercury outer orbit of atom is more active. That means it is ready to cooperate with other things. So this is the first phase of making this medicine. Mercury goes from hingulot, it is extracted from hingul, mercury sulfide, then again with copper, and copper with poison, plant poison, and this mercury is ready after 9 months as the ingredient number 1. Next, please. This is copper. So copper is put into crucible. These are the wires which are taken from the fan because they are purest form of copper. And then it is red hot in LDO furnace. And when they are red hot, they are poured into sesame seed oil 7 times. 7 times it is again red hot and poured into buttermilk. 7 times in freshly collected cow's urine. 7 times in decoction of triphala, it is the 3 herbs, and 7 times in a lentil called pulthi. And after that, this becomes in this form, it is washed and dry. So none of the ingredient which is used in the purification, it is not there. And what we have seen, copper remains copper, only thing it becomes fragile. Is this time if you hit it, rather than flattening, it breaks easily. So this is the ingredient number 2 after mercury, which is used in the copper. Next, please. Now we come back to sulfur, and the sulfur takes lesser time. This is special sulfur which is available in your market. It is melted with cow ghee on the fire, and when it is melted, it is poured into the decoction of triphala, harar, bena, avla, and when it is collected, then it is dried and used in that. Next, please. These are the basic amalgam which are collected and prepared on the fire, and grinding and heating continues for years. It is the repeated processing. It is not something we are doing, and more processing we do, more potent it becomes. And after purifying mercury, copper, sulfur, this process continues for 2 years without any Saturday, Sunday, 24/7. And then what we have seen, that while we are seeing the clinical efficacy, we were seeing this good feedback from the patient, but still we were missing scientific part of it. So this particular mineral complex was subjected to a experimental study where rats were given L-arginine to produce chronic pancreatitis. And when it was given in 2 studies, it was seen that AMAR shows pancreatitis protective properties at the dose of 3 to 4 mg. So this is the first example of a mineral showing the reversal of pancreatitis in an experimental model. So we have more science add to our clinical efficacy. Next, please. And whatever we have been doing, we are continuously presenting at international forums. So we have nearly 3 presentations in United States so far, from Philadelphia to San Francisco and lately in Hawaii. And in India, we have numerous presentations at different colleges, different hospitals, and now webinars and as a conference material, as a main speaker. So this information is spreading worldwide now.